Hey everyone, Dr. Sean Bryant here with E3 Chiropractic and Wellness, and today we're going to be talking about rib joint dysfunction. So to preface this, we've got 12 thoracic vertebrae, and those are the vertebrae kind of through our mid-back of our spine. So each vertebrae in that thoracic spine will have a pair of ribs. So 24 ribs total. They will be connecting to the backside of those vertebrae via two joints, the costovertebral and the costotransverse joints. It will then wrap around to the front and then connect to the sternum through a cartilaginous joint or a costochondral joint. So 3 joints total for each rib in our body. And that rib cage that we have through our mid-back serves to function as a protective mechanism for the vital organs in our chest. So the heart, the lungs, it does a really good job of protecting and making everything very stable through our mid-back. That being said, it's also designed to move freely in twisting motions, lateral bending motions, reaching motions, etc. And when we start to talk about rib joint dysfunction, this is just a general term for describing a lack of movement or a restriction in movement in some direction at those rib joints. So it can happen at any of the 3 joints of our ribs. Typically, we see it at the 2 that are closer to the vertebrae themselves, so the costovertebral and the costotransverse joints. So when we start to talk about this, we start to think about, okay, maybe there's other potential chances for other reasons causing that rib pain. Now, the rib pain that you might have been experiencing with this, it can be a dull and achy pain. It can just kind of feel like a big ball of a knot of muscle that you need to just constantly roll out to try and feel a little bit better. It can feel quite sharp with certain movements of the neck, certain movements of the shoulders, or even just that twisting lateral bending movement. Typically really painful with a deep breath in and deep breath out, or even coughing can sometimes kind of recreate that sharp pain. So when we start to think about what the heck can cause that rib pain, obviously rib joint dysfunction, it comes to our minds as a chiropractor or as a clinician because of how common it is. However, we can't deny that there are a potential chance for other possibilities. So we have to think about clinically, is there pain referral coming from the neck joints or from the mid-back? And that would be kind of like a nerve referral pain. There can be sprains or strains, so sprains to the ligaments or strains to the muscles in the area. Contusion, so if you fell, if you hit the rib somewhere, there can be kind of a bruise or a deep bone bruise. Obviously, the potential for fracture also there. The ribs are strong, but there are weak points in the bone itself. And very uncommon, we can see rib dislocation. So oftentimes with that rib pain that people experience, they'll say, you know what, my rib's out. I can feel it. Feels like the ribs popped out. I need it put back in place. Not necessarily the case. So now we start to talk about why this rib joint dysfunction might be happening in the first place. So 3 of the big reasons that we talk about here in clinic, we first address an improper breathing pattern. So improper breathing pattern kind of stems from our primary respiratory muscle, the diaphragm. So our diaphragm kind of connects to the bottom of the rib cage, and as we take a breath in, it actually expands and pushes downward into our abdomen. If we're not using that diaphragm or diaphragmatically breathing properly, we start to recruit our secondary respiratory muscles. So a lot of these secondary respiratory muscles are supposed to aid in our breathing and that lung expansion to kind of make room for taking that breath in and breath out. However, they're not supposed to be the primary movers of the rib cage. So when those muscles kind of put in over time and they start to do a bunch of work, they can kind of go into spasm or feel super tight, and they can ball up and actually restrict that joint from moving and also mimic that rib out of place feeling. We also talk about poor low back stability, and these two kind of go hand in hand because in clinic here, we talk about diaphragmatic breathing and how imperative it is with our low back stabilizing strategy. So we need to be able to create a bunch of intra-abdominal pressure in through our abdomen to properly stabilize our low back. When we're not doing that, our body is really good at developing compensation patterns to still achieve the goal at hand, which is to stabilize the low back. So a typical compensation pattern that we will see is a cranking on of the paraspinal muscles in the back. So the big long muscles that run along the sides of our spine. And as those get super, super tight, they pull on the ribs, and again, they bunch up, get really tight, and they mimic that rib out of place feeling, and they kind of restrict that rib joint motion. Lastly, we talk about poor scapular stability or poor shoulder blade stability. So we have a total of 17 muscles that attach to our scapula and in some way, shape, or fashion attach to the spine or the rib. So when these muscles, again, if we're not utilizing proper stabilization strategy, or if we have excessive winging in the scapula, some muscle weakness, we turn to other muscles to put in overtime and do a lot of work to try and stabilize our shoulders. So when that happens, we get that muscle bunch up, we get the restricted movement of those rib joints, and now we've got that pain at the rib joint focally. So here in clinic, we take a really thorough assessment. We talk to you about what's going on, the symptoms that you're feeling, and then we get down to the root of what's going on. Stay tuned for further information based on our assessment and treatment of rib joint dysfunction. Thanks.